concentrate your energy there just for a few seconds before we start. Take a few deep breaths. And then commencing with superficial stroking by stroking with one hand from the shoulder to opposite hip, as if you're drawing across the back. And this just introduces your hands to the client and helps to spread the oil across the back. So as one hand comes down, before that hand leaves the back, the other hand comes on, so there's no break in continuity. And then with full palmar contact, we're going to commence effleurage, coming up either side of the spine, up across the top of the shoulders, and then returning with a superficial stroke. And then up towards the underarm and back down again. And then across the lower back. So you're effleuraging in 3 branches. One up across the top of the shoulders. The upward stroke is deeper and the return stroke is more superficial. Gradually increasing the pressure. Important also to use your body weight, so you've got one foot in front of the other to lunge into the stroke, using the walk standing posture. So your hands are moulded to your client's back. Just increasing the circulation, getting the client nice and relaxed, stimulating the sensory nerve endings in the skin. And once we've completed those introductory strokes, we're then going to progress on to some petrissage movements, where we're working deeper into the tissues. So first of all, finger kneading, reinforced finger kneading. So your hand is going to be placed onto the back with one hand over the top of the other, and your fingers are going to be kneading away from the spine. So we're following the erector spinae muscle, which is in 3 bands. So try and relax your hands, relax your wrists and your fingers, and then as you sweep back down again and progress up a little bit further out from the spine. And then return with a superficial stroke, and then out a little bit further. So it's your fingers that are really doing the work, and by having the other hand reinforced on top of the other hand, it's helping to make it a deeper and more effective movement. So one band is close to the spine, and then a little bit further out. Petrissage is a deeper manipulation which helps to break down tension nodules, and you can start to feel the tension in the tissues. And then we're going to sweep down to then do a deep stroke up to the top of the shoulders, and we're now going to knead across the trapezius. Now the trapezius is a large muscle and we're going to be working on its upper fibres. So using your hands and your thumbs, you're going to lift the muscle away from the bone and release it. So passing the tissue from hand to hand, work across one side, also across the top of the shoulder, the deltoid muscle, and then up the back of the neck. So it's like you're squeezing the tissue in between your thumbs and your fingers, but also releasing it at the same time. So you're grasping the tissue and then releasing it, and then working across to the other side. Also including the deltoid, which is on the top of the shoulder, the cap of the shoulder. So kneading can be performed single-handed, like I'm doing now, or you can use both hands together, where you're working either side of the trapezius muscle. And then we're going to perform another technique called frictions. We're going to do this either side of the spine, down the erector spinae muscle. So I'm going to use my thumbs, so starting at the top of the shoulder, small concentrated movements in a circle away from the spine, progressing down approximately an inch or so at a time. So concentrate your thumbs on a specific area of tissue and then circle away from the spine. This is just working deeper into the tissues, helping to release tension nodules, stimulate the nerve endings. Gradually working your way down. And then when we get down to the lower back, you're going to then progress across the back of the iliac crest, back of the pelvis, and then returning with a superficial stroke, and repeat that again. So starting at the top of the shoulders, small concentrated movements. If you find it awkward to perform this movement with the thumbs, you can also use the fingers to friction. Across the back of the pelvis, and then using a linking effleurage coming up to the scapula. Now here we're going to work around the scapula, but in order to abduct the scapula away from the body, I'm just going to take the client's arm, support there at the top of the shoulder, give the arm a little pull, pop the prop underneath the upper arm and bring the arm back up onto the back as far as you can and as far as is comfortable for your client. Does that feel okay for you, Katie, there? So what we want to do is to trace the outline of the scapula. So we're going to use the reinforced fingered kneading technique, working across the spine of the scapula, down its vertebral border and across to its axillary border. So kneading across the top, so working across the supraspinatus muscle and then across its vertebral border. So here you're working across the rhomboid muscles. which often hold a lot of tension, and then down and across to its axillary border. Concentrating on any areas of tension. Usually find you get quite a clear erythema, reddening of the skin where there are the tension nodules, and that highlights you to areas where you can do some extra work. And then using the thumbs, we're then going to knead around and concentrate and knead into those areas that need some extra attention. And then just finishing with a deep stroke around the scapula, and then just reposition the arm, just give it a little pull, and then either let the arm go down the side of the couch or the side there alongside the body, whichever feels comfortable for your client. And then we're going to go over to the other side and repeat that technique. Take the client's arm back, just give the arm a gentle pull. Take your prop, place it under the upper arm and take the hand back as comfortably as it will go onto the back. Some clients will be able to get their arm right back up, but just take it back as comfortably as it will go, and then just ask the client just to relax their arm into there so that it partially or wholly abducts the scapula. And then we're going to do some reinforced finger kneading across the spine of the scapula, the supraspinatus, down its vertebral border, so across to the rhomboids and across to the axillary border. And then using your thumbs to then knead around the direction that we've just been in. So here you can concentrate on any areas of tension. Help to knead them out with your thumbs. Most clients tend to have a lot of their tension nodules in the rhomboid muscles, so along the vertebral border or across the supraspinatus muscle. And then just using a deep stroke before then giving the arm a little stretch, and then placing the arm either alongside the body or over the side of the couch. And then, having worked on both scapula, we're then going to palmar knead across the scapula. So both hands in contact with the back, and you're going to lift the tissue between your fingers and your thumbs, starting one side and working across to the other. So when you're doing this technique, it helps if you focus on a central point and that you draw your hands in towards that central point so that you're covering that whole surface area. And then with one hand, flat hand on top of the other, we're going to work around the scapula in circles, and then draw those circles in an overlapping fashion down towards the top of the gluteal muscles, and then sweep back up. So circle, gradually overlapping, starting from the scapula and then working down to the back of the hip, the top of the gluteals. And then changing to the other side. So around the scapula. And then overlap your circles as you come down to the back of the hip. Use a linking effleurage. Back up again. And then we're going to perform a technique called lifting. So you're working on the opposite side and you're using your hands alternately to lift up the sides of the back towards the spine. So when one hand's lifted up, the other hand comes on, work your way right up to the top of the scapula and then sweep back down with a linking stroke. Sweep back down. And then we would keep one hand on and move round to the other side of the couch to repeat that technique. So lifting across the back, sides to the centre. Looking up to the shoulders and then sweep back down. So back round to work on the lower back now. So you need to find the area just at the top of the pelvis, which we call L4. So back of the waist, and get your fingers in between that groove there, in between the L4 and the back of the pelvis. And you're going to knead into that area. So you're following round back of the iliac crest and then just lightly feather back up again. And that area there is the lumbar plexus, where all the nerve endings and nerve pathways to the lower back go. So if clients do have lower back pain, that will be a useful area to work on. And then double-handed kneading over that area with big circles round the back of the waist and the back of the hip. And then ring. Now ringing is a form of kneading, but you're actually twisting the tissue, so it's only really done on larger muscle groups like the gluteals. So you're lifting and twisting the tissue, and then we're going to repeat those two techniques on the other side. So keeping your hand on for contact, pressing round to the other side. So round to the lower back, so feeling for the back of the pelvis, And then just fingers into that L4, working down around the back of the pelvis, and then just lightly feather the strokes back up. And flat-handed kneading around the back of the pelvis, followed by wringing. So you're lifting and squeezing the muscles. A linking stroke, we're going to go up to the top of the shoulders, working either side of the spine to thumb knead down the erector spinae. So you're using your thumbs to circle away from the spine. So this is a more generalised movement than the friction movement we used earlier. So rather than concentrating on a specific point, you're using larger circles away from the spine. Coming down and then working across the back of the hip. Use the linking effleurage in between. The next technique is called ironing. So we're going to work down either side of the spine with one hand on top of the other. So you're working the heel of the hand into the tissue and rocking it back. So starting from the top and then working your way down. Again, using a linking stroke to work across the surface area of the back, and then across to the other side. And then we're going to perform a skin rolling technique. So if you draw your fingers down towards the back and then draw your fingers towards the thumbs. So you're drawing your fingers up the sides of the back towards the thumbs, and you're working from the side of the back up towards the spine. So draw the tissue up towards the thumb and then release it, and then draw it up again. Sweep back down. And then keeping one hand on, I'm going to repeat that technique on the other side. So skin rolling, fingers coming down to the sides of the back and then pulling up, putting the tissue up towards the thumbs. So you're sliding the tissue between your fingers and your thumbs. You're pulling it up from the sides of the back up towards the centre. And then when you get up to the top, just sweep back down with a superficial stroke. And palm kneading across the back. So this is like the technique we performed earlier, just over the scapular area. So your hands are quite flat, but they're picking the tissue up between the fingers and the thumbs. So we're starting furthest away from you and then gradually working towards you so that you're covering every surface area of the back, crossing over the spine. So again, if you focus on that central point and then draw your fingers in towards the central point, helps to make the movement more rhythmic and flowing. We're going to perform some tapotement movements over the back. Now you would only perform these if there was sufficient tissue density present. We're going to use some light hacking, so just separate your fingers coming up either side of the spine, up and down, so it should sound like falling raindrops. So it should be the tips of the fingers striking the surface. And we can also perform some cupping. And then just using a linking stroke in between. We're going to come down to the lower back to iron over the quadratus lumborum muscle, which is in the lumbar region. So working the heel of the hand into that muscle. Because of the natural lumbar curve there, in most clients it's easy to then be able to mould your hands into that area. And then holding one hand at one side of the back and one hand at the other, you're going to draw the hands up towards the spine to do a double-handed lifting technique. So you're pulling up from the sides to the centre. And then down to the sacral area so that we're not neglecting the client's lower back. Sacrum's a little bit like a triangle. So if we work across the top of the sacrum, so if you find the top of the pelvis, and then working round just concentrating friction movements on the area. And then some deep effleurage over the back of the hips. So you're sweeping around the hips and back in towards the sacrum. Deeply on the upstroke and superficially back down. And then some deportment movements across the top of the gluteals. So packing, cupping,